Welcome to the Erectile Dysfunction Radio Podcast. This is the podcast dedicated to educating and empowering men to address erectile dysfunction, improve confidence, and enhance the satisfaction in their relationships. This podcast is brought to you by ErectionIQ.com. Learn more at ErectionIQ.com.
Welcome to the Erectile Dysfunction Radio Podcast. I am Mark Goldberg, certified sex therapist. I am deeply passionate about working with men like you to help resolve their ED.
Today we're discussing a bit of a difficult subject. It is certainly something that we will not shy away from talking about on this podcast because we want to cover all things related to erectile dysfunction, and that also includes miscarriage. We want to talk about erectile dysfunction and kind of sexual health in general after a miscarriage with your partner. So, Mark, I want to ask first and foremost, is therapy a good option for a couple dealing with a miscarriage, even if ED isn't a problem?
Absolutely. Miscarriage can be traumatic. Regardless of the stage of pregnancy, this can be difficult, and certainly with later stage miscarriages, which carry an understandably higher likelihood of having negative effects on both partners and the relationship. I know this is a really difficult space to navigate. I think it is fair to say that people who intend to have a child through a pregnancy, the loss of an unborn fetus is not just an unborn fetus. I think people begin very early on, certainly when this is an intentional and wanted pregnancy, to invest emotionally into a child. And that loss can really be very, very devastating. I think in a lot of situations of miscarriage, it leads to unspoken tension, hurt, pain, and this can cause all sorts of downstream relationship problems that I think couples can benefit from if they're going through this, and certainly if they're feeling pain, if they're feeling that tension. Getting ahead of that, addressing that with a professional can really make a big difference in their lives and ultimately in the quality of their relationship moving forward.
A miscarriage is no doubt a major life event, traumatic to say the least. How can major life events such as this impact the quality of a man's erection or cause erectile dysfunction?
So as I touched on before, I do think that a man may be mourning to a certain extent the loss of an unborn child. The stress, grief, anxiety, depression, which are all things, as we've spoken about on this podcast, that certainly can impact and interfere with erections. It's difficult to experience pleasure when you're depressed. It's difficult to relax. It's difficult to free your mind. Even if a man is not feeling these things acutely, his partner may be, and may be struggling with these feelings of depression on her own. That can make her unavailable, disinterested, not open sexually, and not really interested in engaging in sexual activity. And that can lead to feelings of rejection or not really feeling like a partner is engaged, can negatively impact a man's arousal and ultimately impact erections. Even after both partners feel like they've reached a point of emotional healing, there can be a fear of another miscarriage. And since sex is, inextricably linked to procreation, the act of engaging in sex can, possibly trigger all sorts of fears and have a negative impact on a man's ability to gain and maintain an erection, as well as impact his ability to ejaculate. So, anejaculation is another sexual dysfunction, which we have not yet covered on the podcast, but we will give it its own episode because it does deserve that. But specifically, when it comes to fear of pregnancy, there is a phenomenon, or at least a documented phenomenon, that men who are afraid of impregnating their partners can experience what's called anejaculation, where they will engage in sexual activity, but they will not hit the point of ejaculation. And I think fear of a pregnancy that could lead to another miscarriage even after healing, could be something that leads to an ejaculation, could be a psychological way of the mind protecting this person from putting them into a painful or potentially threatening situation again.
And now let's talk about trauma itself, because miscarriage can be a source of trauma. Can you remind us and our listeners here as to what trauma is and the psychological impact of trauma?
Sure. So trauma really at its most basic form is any event or any occurrence that is psychologically disturbing or distressing. I know that's a really broad clinical definition, but trauma is considered to be a very broad and almost human experience. Now, trauma causes a lot of potential symptoms, many similar to depression and anxiety disorders, and it can also impact other areas of mental health. Now, some people will experience acute triggers when they're reminded of a trauma experience that can result in more specific and more pronounced psychological symptoms like mania or disassociation, which is when a person kind of zones out or tunes out, to put it at a basic level. So trauma really plays across goes down these two roads where a lot of the symptoms can be similar to or can actually cause anxiety and depression, and it's more of a long-term effect after a trauma. And it has more of a unique component that if acutely reminded of a trauma, that can trigger a much more pronounced psychological response.
So can trauma cause erectile dysfunction?
For both of the reasons mentioned above, trauma can be an underlying factor or a primary cause of erectile dysfunction. So again, for some people, the lingering general effects of trauma like anxiety and depression are going to interfere with desire, interfere with arousal or the erection process, as we've outlined many times. It's harder to be receptive to pleasure. With anxiety, the body is releasing all sorts of hormones that are going to interfere with blood flow. When people are experiencing or have experienced a sex-based or a sex-related trauma, the act itself can trigger a trauma response. So when it comes to miscarriage, which again is very much associated with the act of sexual activity, that can cause a very acute type of response. I think it's also important to explain that these traumatic responses can cause blood flow to be diverted from the penis and toward other areas of the body. The body is designed to protect you. And when a threat is detected, which is a big part of the trauma response, the body looks to protect its most important parts, like the vital organs, and is less concerned about the extremities like the penis. So yes, your brain in these moments values the kidneys and the liver and the heart more than the penis. This is a much broader topic that we, again, need to cover more thoroughly in a future episode. But I think at least that part should be understood, that there is actually a physiological connection between what is happening up in the brain and what the body goes ahead and does.
And you discussed earlier how there is no procreation without sex. So obviously things psychologically can trigger each other, right? So having sex can trigger the memory of the miscarriage, obviously because linked to procreation. How can couples deal with this, such a difficult situation?
I think this is a really important question. And I want to be, upfront that this is not a specific area of expertise for me. So I'm not sure if healing of a trauma is always best to be done in a couple setting. It probably depends on the couple, the quality of their communication, and the specifics of their situation. As a therapist, my bias is for people to be able to talk and process these experiences and their feelings about it. For some people, they're going to process this on their own or in individual therapy and eventually may share this processed experience with their partner. And for other people, they may want to process this, express their thoughts and feelings in a much more raw form with their partner. Oftentimes, partners are on different sides in terms of what their preference is in dealing with the trauma, which can create some tension and where professional help is really of benefit. But trauma is complex, and if having sex is triggering painful memories, I think any suggestion I would make now would just not be adequate or respectful to the depth of these experiences. To that end, though, I think that being patient and supportive of each person's process is tremendously important. I don't think you can rush your partner or try to push them forward on your own. I think you have to be supportive, and I think you have to support their process in seeking help from a professional. So that much I will say, but I don't think that healing from trauma is an easy thing to do, and I don't think that it can be done with some basic tips from me. And I want to respect the depth of these traumatic experiences for people who are going through this, while encouraging them to reach out and seek help, because it can make a tremendous difference, and it can help get things back on track now and make a tremendous difference in people's relationships and in their general quality of life down the line.
Is there anything else you want to add to the conversation before we wrap up here today?
I think I kind of summed up that take-home point in the previous question. I would just say, go back and you can play that part again. That's the part I would reemphasize, is that trauma is complex, and I don't think there are any quick or easy fixes that somebody could tell you. If it's impacting sexual function, there are ways to address this, and there are professionals out there that can help. So please, I know that these are difficult situations that people find themselves in, but there's no need or there's no reason to suffer in silence. There are people out there that can help make this better, help repair, help you heal both individually and with your partner. And you should look to do that sooner rather than later in the process.
Thanks for listening to the Erectile Dysfunction Radio Podcast. For more information on today's topic and understanding how the mind impacts erectile dysfunction, please visit erectioniq.com. That's erectioniq.com.